Are you someone who's dealing with some type of back, butt, or sciatica pain? So pain, numbness, tingling going down one or both the legs, and you're trying lots of different things, but it seems like no matter what you try, the problem keeps coming back. So I want to help you get to the bottom of this and help you understand what you don't know, because these problems keep coming back for a reason. So many people say, well, I don't know why. Well, just because you don't know why doesn't mean that there's no reason there. It's just that you don't know the reason. So someone like myself who helps people all over the world with these problems can absolutely help you dial in why this keeps happening. And it usually happens big picture for one of two reasons. Physically, habits, routines, things you don't know you're doing continue to nick the scab or pick the scab and keep you from healing or getting better. Or mentally, fear, worry, concern, stress, anxiety around the pain fuels it. Hey everyone, this is Dr. Charlie Johnson, physical therapist, and as someone who's worked with just over 10,000 people with back, butt, and sciatica problems and teach people how to fix their own issues, just recognize that it wasn't always that way. What I recognized very early in my career is that I was good at fixing people in the moment, but the people in pain like you were terrible at fixing themselves. In this video, I want to help you identify exactly what is picking the scab and keeping you from healing. We're going to do it via a process I call morphing motions. And if at any point as we go through this video, you are questioning the cause of your pain, maybe you're doing some things or we go through some things and you say, well, that doesn't sound like me. Maybe I don't have sciatica. Then be sure to grab my DIY diagnostic guide above or there's a link in the comments. All right, so I'm going to pull up my whiteboard. Let's dive in and let's start teaching you how you can figure out, again, what's keeping you from getting better. All right, so the first step to figuring out what continues to nick the scab and keep you from getting better is to translate that which you don't know into something which you do know. Diagnosis, you don't know. It's unfamiliar to you. You have to research it. You can't really feel it. It exists beyond you because it is on a picture. It is outside of you. What are you going to do about it? Let's make it something that is internal to you that you can see and feel, which is motion. So let's translate your diagnosis into motion. And what do I mean by that? So if you have sciatica, chances are very high that you have trouble or pain when you're trying to stretch the nerve in your leg. Sciatica is going to show up. Sciatica, a diagnosis due to whatever the cause, is going to show up in a certain way. And how is it going to show up? It is going to show up in the form of a yucky leg raise. And so this leg raise test, you can try it now. If you have true sciatica, and you do not have a yucky leg raise, then you can feel very confident that you do not have sciatica. Now, this is something you can see and you can feel. Call it whatever you want, do to whatever you want. But at the end of the day, yep, Charlie, that hurts. So you can do it on the right side, you can do it on the left side, and just get an idea of what it feels like. But if it's yucky, then again, chances are you probably have some type of sciatica or nerve irritation somewhere in the back, butt, or leg. And the reason that this leg raise hurts and bothers many people with nerve issues, sciatica, if you will, is because when you straighten your legs, you pull down on the spinal cord and the nerves. And if it's a bit angry, if your nervous system's angry, then it's going to say, ouch, it's going to cause you pain. So that is why the leg raise is yucky. But let's make this even simpler. We can further reduce this leg raise and this yucky motion into something that is very relatable. And so now the question becomes, the next step, after we've translated diagnosis, what you're told is wrong with you, into something you can feel and make sense, we need to do what I call morph motions, right? The importance of this is that life equals motion. So whether or not you know it right now, there are definitely things you don't know. And this leg raise shows up in life because life is motion. So now what you need to do is you need to go one step further. You've got the stick figure, you've got the yucky form, if you will. Now you want to ask yourself, what am I doing in everyday life that looks like the leg raise? What are you doing in everyday life that looks like this? And so what's really cool is we can just start to manipulate the stick figure. We can start to say, what does that look like? Oh, it looks like when I'm bending over to pick something up, or maybe this looks like a yoga move or whatever. And all we're starting to do is just manipulate this stick figure in our brains to become aware of things that maybe we weren't aware of previously. Awareness is the first step to healing. All right, so let's review a couple common things. Once you identify these things, if you have some aha moments of like, wow, I never thought of that, then that's good, number one. But then number two, you want to start manipulating your environment so you find different ways of maybe doing these activities so that you can kind of tweak and or temporarily avoid them to allow yourself to heal. Because if you're doing things throughout the day, right, that are constantly putting you in a leg raise, and you could continue to pick the scab and keep yourself from getting better. All right, so If you have a yucky leg raise, maybe you haven't thought of it, but you probably have trouble driving. It's a leg raise. Maybe you've been told. So here's the interesting thing is that most people are doing things intentionally because they've been told to, and they don't really understand why they're doing what they're doing, and they don't really understand these concepts. So they've been told to stretch their hamstrings or their IT band, or they've been told to do nerve glides. And if you think about it, it doesn't really make a lot of sense. Why would you do that which is painful over and over again? Do this 3 times 30 reps and do it twice a day. So it might be some things you've been told to do. Down dog yoga is good for sciatica, right? So let me do that. Yeah, you're doing a leg raise. You might want to think about not doing that. Why is it, Charlie, that I can't run? When I try to run, well, that's a leg raise. How do you know that that's going to be a problem and I can't do that thing? You didn't even evaluate me, Charlie. You're all the way across the world. How can you help me out? Because you got a leg raise. And that thing you're doing, that's how it's showing up. Right? So you're not going to be able to run. You're not going to be able to sprint until you free up your leg raise. Maybe you sleep and you don't even recognize it, but you sleep in a leg raise. Picking up an object. So a forward bend, assuming your legs are fairly straight, is a leg raise. Right? So here's your leg raise. Forward bend is a leg raise. Golfer's lift is a leg raise. Deadlift is a leg raise. Are you seeing that? All right, we're just playing with stick figures. Maybe you're like, got this yucky leg raise, but man, I love sitting in bed at night, or in my bathtub at night, or on my ottoman at night, kicking my legs up and just relaxing. And sleep is terrible, Charlie. Yeah, because you're sitting in a yucky leg raise before you go to bed. Hopefully this makes sense. You get the idea of translating that which you don't know into motion, or something you do know and you can feel. You don't need to rely on somebody else to tell you what you need to do, because you are the source of it. You can move your body and you can feel your body better than anybody else. Great. If you truly have sciatica, chances are you have a yucky leg raise on one or both sides. And the reason is because you're pulling on the nervous system, you're tensioning it. And if your nerve's a little bit angry for whatever reason, somewhere, due to whatever you want to call it, then you're going to tension it and it's going to say, ouch, don't do that. And to make this really relatable, then you're going to take that motion and put it into stick figure form. And this is the stick figure, right? This is what a leg raise looks like. Hopefully it makes sense. Once we've translated that into a language which makes sense to you, then we can say, okay, now we need to morph those motions into our life. This is useful because life is motion. If we can free up the yucky motion, which is the leg raise, then we can get you back to doing life. So in order to do that, you need to start to question or ask yourself, hey, what am I doing in everyday life that looks like my yucky leg raise? Again, some things are obvious, but my guess is you had a few aha moments and you start to say, that wasn't so obvious. And so you want to start thinking of things differently. And some very common, and there are many more, some very common ways that a yucky leg raise would show up would be if you're driving. And so look, here's the thing. Maybe you can't avoid driving. That's not the point of this. The point is to tell you not to do any of these things. It's just say, hey, could you do it in a different way maybe? So maybe you can't stop driving, but maybe you could change how you sit or how you drive or the seat position or the surface or something like that. It shows up in things that you've been told to do and that you're doing intentionally, not intentionally to hurt yourself, but you're doing it intentionally with the intent of fixing yourself, but they're actually just recreating the yuckiness over and over and over again. You will have trouble extending that leg, as in running, or maybe long stride or fast-paced walking. Maybe when you sleep, you could be doing yucky leg raise, tensioning a nerve, reducing blood supply, taking yourself off, picking up things, deadlifting, all that stuff. Maybe chilling on the couch before you go to bed, which sets you up for a yucky night's sleep. All right, so hopefully this was useful and helped open your eyes to a different way of thinking and a different way of viewing things, and maybe even a simpler way of viewing things. Pain relief does not have to be complicated. There is no correlation between the amount of effort you put into solving this and the amount of relief you get. Less is more. You want to work smarter, not harder, and this today was an example of how you could start to do so. A little bit of a ninja tactic called morphing motion. So hopefully, again, this was useful. Let me know your thoughts below in the comments. Hit the like button, as well as hit the subscribe button and the bell for notifications when I go live every single week. Thanks so much for watching. Until next time, take care.